Hi, beautiful people. How are ya? I hope you're having a great day. Did you have a great weekend? I hope so. Mine's always been busy, and then this past week has been quite busy too. My grandson Charley was over this past weekend and helped me paint the wall behind me. And we actually put together one of those bookcases, just the top part of it and the outside of it, and we gave up. It was too much work with my vision issues and his lack of knowledge. My husband and I, well, mostly my husband, I just handed him stuff, put together the rest of that one bookcase and the other two. So the wall's finally done, at least from there where you can see over to where you can see right here. There's more to do. There's a whole room in here that we would like to get finished eventually. But Charley's 14, and at 14, I was quite proud of him for what he did to help me accomplish what we did. And I think he learned a lot about painting. He said he'd never painted before. And he said, normally he just plays video games. So he got a workout. He got tired after putting, well, I got the first coat on. And then he and I worked on the second coat. And then I did the third coat because he was tired. But that's okay. I didn't mind at all. The third coat, as you can imagine, goes on really quick. But I think he enjoyed the praise afterwards. Did you enjoy the video on Tesla, the guard dog? I think I needed a break from doing research. It takes a lot out of me cognitively to research everything and organize the information I put together and get it in written form. So it makes sense as I put it out there for you all. I will have another day in the life video about our backyard and the process that we went through with this wall. So, yeah, I was able to at least get all of my pretty decorations. My chair's kind of in the way here, but all of my pretty decorations on there and pretty much all of the books that we owned, including my husband's textbooks and his books on electronics. So, but today we're going to talk about what researchers are calling chronic overlapping pain conditions, or COPC, which they're pronouncing COPs, and what that means for the future of fibromyalgia research. So here we go. I've talked about overlapping conditions quite a bit, and I wrote about it a lot in my dissertation. I mean, there's been information on overlapping conditions for many years. So this information on chronic overlapping pain conditions is new to me, either that or I just don't recall it. And that's possible too. But the term COPS was coined by the National Institutes of Health. COPS describe conditions that often coexist and share similar disease mechanisms across the neurological, endocrine, and immune systems. Conditions predominantly or solely affect women. Any number and combination of conditions is possible. Several conditions can develop at once or gradually over the years. As research advances, new associations are being uncovered. Researchers stated there are more women than men who have common or highly prevalent chronic pain conditions coexisting in their bodies. The National Institutes of Health and the U.S. Congress have recognized the concept of coexisting pain conditions as a set of disorders that co-aggregate and include 10 disorders. There are more that are suspected to be part of this, but these are the 10 major ones. This is interesting to me because now there's an actual classification of COPs. The Chronic Pain Research Alliance explains each of these conditions and their overlap. So they're the following: temporomandibular joint disorder, fibromyalgia, irritable bowel syndrome, vulvodynia, myalgic encephalomyelitis, or chronic fatigue syndrome, we call ME/CFS, interstitial cystitis, also called painful bladder syndrome, endometriosis, chronic tension type headache, migraine headaches, and chronic lower back pain. These were according to the 2016 study. In 2017, dry eyes was proposed as a COPS. And in 2023, regional pain syndrome and long COVID were potentially added to the list. However, those 10 remain the most common. So, where you find one of these disorders, it's highly likely to find two or more occurring at the same time. According to the CDC, 21% of Americans, or 51.6 million adults, experience chronic pain, i.e., chronic pain that results in substantial restriction to daily activities. Chronic pain is defined as pain that is felt on most or every day for at least 3 months and can affect daily life and work. It's a debilitating condition that affects adults in the U.S., and I'm aware it affects people all over the world, and has been linked to depression, dementias, higher suicide rates, and substance use and misuse. Substantial healthcare costs and lost productivity are also common. It's a public health imperative. So I would like to ask you if you would put a 1 in the comment section if you have only fibromyalgia. But if you believe you have fibromyalgia and at least one other condition that I mentioned, put a 2 in the comments section, and feel free to tell us what the other disorders are if you've been diagnosed with them. Or feel free to tell us if you believe you have them without a diagnosis. According to a 2017 study, researchers stated that as many as 1 in 5 adults in America still suffer from some form of persistent pain. But a new term has evolved over the years, and that is high-impact chronic pain. I might do a separate video on this. The groups of people that I just mentioned are among the groups that have developed a higher prevalence of chronic pain and high-impact chronic pain. According to Chronic Pain Research Alliance, the National Institutes of Health, or NIH, the nation's federal medical research agency, has invested over $40 billion in medical research for the American people. Chronic pain is as prevalent as cancer, heart disease, and diabetes combined. However, the NIH spent 88% less on chronic pain research than it did on research for these conditions. This investment has improved over previous years due to a congressional appropriation of over $1 billion for the HEAL initiative, approximately half of which was allocated specifically to pain research. Chronic low back pain research resulted in $66 million in 2022, and fibromyalgia research resulted in $12 million. In 2016, researchers stated a percentage overlap of conditions based on research. For example, in fibromyalgia patients, 80% have IBS, 75% have temporomandibular joint disorder, 64% have ME/CFS, and if you have vulvodynia, 23% also have fibro. An article written in 2010 stated the following, but let me first give you a trigger warning for some of you who have gone through these difficult times in the past. So this is your trigger warning. Quote, a growing body of literature also documents a pattern of discrimination in the care and treatment of women with chronic pain conditions. Studies have shown that women report pain that is more frequent, more severe, and of longer duration than men, but are nonetheless treated for pain less aggressively. Healthcare professionals often take women's pain reports less seriously than men's. Healthcare professionals are more likely to dismiss women's pain reports as emotional, psychogenic, hysterical, or oversensitive, and therefore not real, leading to more frequent mental health diagnoses rather than treatment for pain, unquote. I don't feel like I experienced this by my rheumatologist, but yeah, from my primary care doctor at the time, but I ignored him, and I would print literature, actual research articles, and give them to him so that he could read them. And I think that helped him to become a little more sensitive to my plight. If you have centralized pain, you'll experience non-restorative sleep issues, widespread pain, have a change in affect, meaning experience anxiety, depressed mood, and irritability. You will also experience cognitive problems and energy problems. According to Vanderbilt Health, the acronym to remember this is SPACE, which stands for sleep, pain, affect, cognition, and energy. This is Vanderbilt's health explanation of central pain and how you can tell if you have it. According to the University of Otago in New Zealand, the common COPE symptoms are pain, fatigue, poor sleep, difficulty with thinking and understanding, mood swings, anxiety and depression, stress, and decreased ability to perform daily activities. Basically, what Vanderbilt Health stated, although the university in New Zealand added stress, which I think is appropriate. It can be challenging for medical professionals and researchers to assess what conditions and individuals affected by. So a chronic overlapping pain condition screener is available to health professionals. The screener is a tool that assesses the presence of 10 COPs. The links are in the description. These are the 10 COPs analyzed by the screener. A body map is used that shows the association of body areas of pain to specific COPs. Well, I tried something new and thought my video was recording properly, and it wasn't. I'd already put my hair up, took off my lipstick, and you're going to get what you get from here forward. So, my apologies. I know I look different. This screener doesn't provide a diagnostic, rather a screening for each of the 10 classifications, as well as the estimated number of conditions coexisting within a given individual. These coexisting conditions are sensory neurological disorders that are more prevalent in females. According to the 2019 User's Guide, the purpose of the screener, from what I've read, is for researchers and health professionals to analyze the presence of multiple conditions in an individual and for, quote, discovery of common risk factors and biological pathways that could pave the way to improve diagnostic procedures and new personalized non-opioid treatments for these conditions, a needed advance in reducing reliance on opioid therapies, reducing population-level opioid exposure, and reducing negative life events, including death, unquote. That's from the University of Michigan. I doubt that most of our physicians even know this exists. It would be great if we could print the page with the information on how to download this tool for our physicians and see if they're interested in it. I've linked it in the description section. And you can try out this screener here. The link is in the description section for your convenience. So I hope you learned something. I send you gentle hugs and support. Love you. Good grief. I went to edit the video or get started on editing, and I was like, what on earth happened? My allergies are terrible right now for some reason. Pardon me, please.